Good morning, all. So, the next part of the discussion will be on the importance of optic disc evaluation. I have no financial disclosures. So, we know optic disc evaluation is a part of comprehensive eye examination. And pertaining to glaucoma, it helps in the detection of glaucoma and monitors the progression of the condition. These are various parameters by which we evaluate an optic disc. And even any subtle change in the optic disc can be an early indicator of glaucoma. So let us see how these parameters helps us in our decision making. So going to our first case, we have a 28-year-old lady who came to us for a second opinion, presented with the best corrected visual acuity of 6.6 N6 and intraocular pressure, cornea adjusted measured by GAT at 3:30 p.m. was 23 in right eye and 19 millimeters of mercury in the left eye. Anterior segment examination was within normal limits and gonioscopy showed open angles. This is the fundus picture of both the eyes. So where we can see the disc appears slightly larger than normal and there's a healthy neuroretinal rim and good RNFL visibility and the CD ratio is around 0.7:1. Now considering the disc changes, so the question here is whether to treat this patient or not. And for that we should know whether the disc is normal or abnormal. So we did a visual field analysis and it came out to be normal, and even the OCT showed normal OCT picture and it corroborated with a large disc size. So having considered the OCT to be normal and the visual field to be normal, would you treat this patient now?
So how many would treat this patient? Good.
Okay, let's have a closer picture of this disc. So if you see in the left eye, so the inferior rim is wider than the superior rim and the ISNT rule is maintained. But in the right eye, if you see, the vessel bending is here. So the inferior rim is thinner than the superior rim. So the ISNT rule is not maintained here. And when you correlate the disc picture with that of the visual field, we can see that there are superior defects in the field. But the Anderson's criteria is not met. So the alarm bell should ring whether it could be an early glaucomatous change. However, in the left eye it was normal. So will you treat now?
So how many would like to treat this patient?
Yes. Okay, coming to second case. We have a 28-year-old female who came to us with a headache, history of headache, nil significant history, with a visual acuity of 6.6 N6 and intraocular pressure cornea adjusted was 15 millimeters of mercury in both the eyes. Anterior segment again normal and gonioscopy showed open angles. So this is the fundus picture of both the eyes. In the right eye was absolutely normal, and if you see in the left eye, the disc appears large with an inferior rim loss. Okay, so when visual field analysis was done, so right eye was normal, and in the left eye, corresponding to the inferior rim loss, there's a superior hemifield defect. Now, considering only the visual field alone, will you start your treatment?
So how many will not treat? All the others will treat actually. There are just about 10% who have said they will not treat. That means about 80-90% will treat. Okay, next.
Okay, let's have a closer picture of this disc picture. So if you see, the disc appears large, it's irregular, but when you see here, there's a clear, demarcated, deep excavation which is seen. Absence of a neural and the retinal tissue, and it is suggestive of a coloboma, which has produced the superior hemifield defect. On a dilated examination, we picked up retinal colobomas as well. So now, considering this, would you treat or not? Okay. So we should be aware of the mimickers of glaucomatous optic disc because it can also produce visual field defects. Now going to our third case, we have a 45-year-old gentleman with a family history of glaucoma, came for a routine examination with the best corrected visual acuity of 6.6 N6 and pressures were 20 millimeters of mercury in both the eyes. So anterior segment within normal limits and gonioscopy showed open angles. So this is the undilated fundus picture, which showed symmetrical cupping in both the eyes. And obviously, we did a baseline glaucoma tests. And this is the visual field picture of both the eyes. OCT showed a symmetrical borderline thinning in both the eyes. This is the dilated fundus picture. Okay, so when we have a closer look at the disc, we say it's an average size disc, but the inferior rim is thinning. Thinning is seen, okay? And as compared to the superior rim, so there is a ISNT rule is not followed. At the same time, we can appreciate the RNFL defects here. So when you correlate the findings with that of the visual fields, we can see there are corresponding changes happening in the fields. So now it's a straightforward case of primary open-angle glaucoma where the treatment has to be initiated for this patient. So the take-home message will be optic disc evaluation is essential in the glaucoma diagnosis, and the dictum is here to dilate each and every patient who walks into the glaucoma clinic. Also remember that technology is just to support our clinical findings, and solely relying too much on technology can often be misleading.